Good day, everyone. I'm Denisa Fernandez, a reporter for INQUIRER.net. For today's episode of INQside Look, we have Makati City Mayor Abby Binay to talk about the city updates and probably a bit of politics on the side. Hi, Mayor. Thank you for joining us today.
Hi.
So to start, Mayor, since the EQ just ended po and the deadline for the cash assistance lapsed on Tuesday, may we know po if Makati was able to distribute 100% of the cash assistance?
Yeah, we were unable to distribute the cash assistance by 100% kasi marami pong hindi nag-update ng kanilang GCash because we were distributing our ayuda via GCash. So we have asked for an extension with the DILG, and at the same time, we are currently doing a house-to-house visitation of all those that have not yet received their ayuda. And there are still over, if I'm not mistaken, 300,000 emails asking for ayuda. So this is part of our grievance mechanism. So imagine the volume of emails that we still have to go through and filter to check and verify if they are really qualified for the ayuda. So we are hopeful that we will be able to still give the ayuda once an extension is given by the ILG.
So when is the scheduled extension po? Do we have a date already?
Well, we already sent a letter yesterday for the extension, so it will really depend on the DILG on how long we will be given to still distribute the ayuda. But even while we are waiting for the extension, we are verifying verifying and finishing up the grievance. Kasi may mga naghahabol pa kasi ng ayuda. So hindi, kumbaga, may pera pa naman. So we're hopeful that we will be given that extension.
Okay, but the target po dun sa cash assistance, ilan po yung target and how many have received already?
Well, the target is 100. Of course, the target is 100%, right? The total number of beneficiaries, hold on, let me check my código. Kasi I always check every day on the status of our ayuda. We will see if it's necessary to do a manual payout instead of a GCash. Maybe we need to reassess. But as of the moment, we are around 68% or kasi okay. The thing is when you update your GCash account, there's also a KYC. So and the person that should be the recipient and the GCash holder should be the same. So we know for a fact that the person receiving is the same person.
Okay po.
Yung gagamit yung GCash ng iba, hindi nila yung account or hindi verified yung account nila. So this is also as a form of security that the person receiving is the right person and the person is a real person. So we are currently at almost 69%, and we still have a pending amount for KYC, which is over almost 4,000 beneficiaries. So madami-dami pa yung naka-hold sa amin.
So that 4,000 included po siya dun sa total beneficiaries?
Yun yung naka-pending na ha for disbursement. So we still have around 61,000 for disbursement.
61,000 beneficiaries po.
Beneficiaries, yeah, 61,000.
But the total po, ilan po yung total beneficiaries po natin for this cash?
Total beneficiaries is supposed to be 268. 268,123. That's the total number of beneficiaries with the amount given ha, if I'm not mistaken. Wait lang. Yung total amount kasi na natanggap namin is 517,419. 517,419,000. So then I guess if you divide it by 1,000, so ganun kadami yung beneficiaries.
Aside from the GCash problem po, do you have any other challenges that you were facing when it comes to this payout?
Well, the I guess yung iba, they're not so techy. They're not familiar with the system. They wish that the system is still the manual payout, pero not really understanding the risk of having to let people fall in line and congregate in large numbers. Kumbaga sa yung 1,000 pesos, kulang pa sa pa-hospital yun. So the cost benefit of a manual payout is just too high. So kinakailangan lang namin na paliwanagan paulit-ulit yung mga tao na siguro kung magma-manual payout man kami, konti na lang. Hindi yung kagaya ng iba na large volume is a manual payout.
So now po, Mayor, as in exclusive po, the payout is through GCash. Paano po yung
Yes.
iba na without access to, let's say, internet connection po for that?
Okay, kasi sa Makati hindi pwede walang internet connection eh. Sorry we already have free internet for the entire city. So that's part of our PPP program as early as 2017 for our free internet. That's also the reason why hindi kami masyadong problemado sa aming mga estudyante na nag-online class because of our internet. Kung sasabihin mong walang internet, medyo malabo yon. Kung sasabihin mong wala silang cellphone, medyo malabo din yon. Because we know for a fact that mas marami pang taong may cellphone kesa sa landline. Now, if you're saying that there's difficulty or hindi nila masyadong naiintindihan yung instructions, that's why meron kaming jeepney maki, meron kaming mga stations sa barangay where they can go and ask for assistance and guidance on how to update their GCash or their account in the portal. Kasi alam mo, kung hindi tayo uusad and if we don't push for electronic distribution, we will not move forward. And I think here in Makati, they know for a fact that if you do have a GCash account, you know that it's easier for you to get your ayuda. You know that it's easier for you to get your subsidy. Kasi we've been doing this for more than 1 year. So, dapat sa kanila it's already a necessity. Hindi siya option. Ang nagiging option na lang namin is yung manual. Pero ang primary talaga is electronic transfer. So, yeah, you really have to adapt to the times. Kung hindi sila, kung kaya nga ginagawa namin is pinupuntahan din sila sa bahay to verify may problema ba? Nandyan ba kayo? Anong problema natin? Mali ba yung nilagay mo na data? So we are already extending that service by going house to house to look for these people.
Okay, so Mayor, yung house-to-house po natin is hindi din po siya distribution, just assistance po if they're having difficulty in accessing online transfer.
Yes. Yeah, you have to remember that I think a lot of people don't understand when you do house-to-house distribution, especially for money, dapat yung taong nagbibigay ng pera ay bonded. Diba? Ano yun? Bonded siya. Plus, yung security, they're holding cash. Pag na-hold up sila, paano na? So it's really a security nightmare to hold so much money. Plus, pwedeng mangyaring nanakawan daw, pero hindi naman talaga nanakawan. Pwede din naman na nanakawan naman talaga siya. Or pwede naman na ang hirap nung may hawak kang pera. Pwede din naman kasi namin gawin na electronic din. Yung parang pasaload. O, papasa ko na sa'yo yung pera. Pero may cap din kasi yan. There are certain BSP policies that are limitations to the distribution. So there's only a certain amount that you can hold in your digital wallet to distribute. So again, we really prefer that it is done centrally in City Hall.
So now, Mayor, I'm shifting to COVID-19 cases naman po. May we know the city's bed utilization when it comes to COVID-19 patients?
Okay, for COVID-19, bed utilization, are you talking about hospital?
Yes po, ma'am.
Hindi quarantine facility.
Meron po bang overall data about that po?
So ang hospital utilization namin is at 72. Yung quarantine facility namin is at 93.
For the hospitals po, that's all of the hospitals in
No,
Makati.
that's only hospital ng Makati, because we only have 3 hospitals in the city, but there are only 2 that accept COVID-19 patients. So that's hospital ng Makati and Makati Med. So dalawa lang kaming nag-accept ng COVID patients.
Okay, so the data is for hospital ng Makati only.
Yeah.
Okay. So now, Mayor, that the ECQ just ended, does the city of Makati already observe its effect? Did daily cases already decline?
Wala pa eh. I think it's still too early. Our cases are still going up. As of yesterday, we were at 2,518 active cases. We are hopeful, although hindi siya ganun kataas kagaya dati ha. Dati talagang yung pagtaas ng kaso on a daily basis was higher. But it's still increasing, but not as steep as before. And we're hoping that the ECQ, kasi alam mo sinasabi lagi ng DOH, which I also agree, during the hard ECQ, the previous 2 weeks, hindi kasi natin, the mobility was still there. There was still mass transportation. So as compared, we cannot compare the ECQ, the previous ECQs with the last ECQ and expect the same effect, because there was still mass transportation, there was still mobility. So kasi we were also doing our vaccination. So again, the difference also in the previous lockdowns was the presence of vaccination, because in the 2 different ECQs there was still no vaccination, although the second one, yung early this year, meron, pero konti lang yung nababakunahan pa. So I think I also agree with certain observations by doctors that the steady increase, hindi steep increase, is also caused by the fact that a lot of people are already vaccinated. So again, when I look at the numbers, it is not the number of active cases that I look at, but I look at how many are severe and critical. Because even the DOH admits that 20% or less than 20% are severe or critical cases.
For you, what are the measures that could save people or that could lessen the cases?
Well, parang ano na nga, elementary na, di ba? It's already elementary that you should know the basics. The minimum protocols, social distancing, wearing your face mask. Ako, when I go out, I double mask. I'm vaccinated, but I still double mask. I still wear my shield. I still exercise all the precautions as if I am not vaccinated. You do have to live with this virus. Diba? The world cannot stop. We try to keep on stopping our daily routine because of the virus, but at a certain point we have to live with it, because I believe it's not going to end anytime soon. So minimum precautions, paranoia in a way, but you still have to work, you still have to help the economy, you still, di ba? Life goes on with the virus.
So for you, ma'am, do you see lockdowns working po to curb the cases?
Okay, lockdown. Lockdowns don't. The reason for the lockdown is to be able to detect community transmission. It is not really to curb. Well, in a way to curb, because if you are able to detect it in that area, then it will not balloon. So that's the curbing of the pandemic. But granular lockdowns, or any form of lockdowns, is just to be able to see if you are really being able to capture the right picture. Meaning, a case in point, prior to, we were able to lock down this street in Pembo. There were two houses. They were across each other. They were both active cases. And we said, there's a lot of active cases there. Can we see if it's just confined in these two homes, or it's already scattered with the other neighbors? So true enough, I think we were able to capture a considerable amount in that street alone, that they were all asymptomatic. I didn't know that they were positive. So the problem with the virus is, one, you don't even know you have it. Two, the right time to catch it, because the timing for testing is very, very crucial. So yun din yung reason kung bakit parang hindi siya tumitigil, kasi it passes on from one person to another, to another, to another. So it's never ending.
Okay. So Mayor, now po na we still see a rise in cases, do you recommend po na parang i-extend yung mag-shift to ECQ again?
Okay. There's always that question of balancing between life and economy, or health and economy. Um, the ECQ helps at a certain point, but at a certain point, it's no longer effective. Kaya nga, di ba, I was saying earlier that if you undergo ECQ, but there's still mass transportation, there's still mobility, there's still a lot of people going out, then it's not going to work. So, sa akin, pwede naman kasi self-discipline. It doesn't have to be imposed by the government. If you don't feel well, you have any symptoms, don't go out. If you go out, you don't not wear a mask. You should wear a mask. It is all about self-discipline. Kung tayo mag-uumpisa sa atin yung minimum protocols, without the government even looking, without the government even having to impose it, there's really no need for an ECQ. Ano siya, if it's part of your good manners and right conduct, it's not, I don't think it's going to be, you don't need an ECQ.
Okay po, Mayor. So now let's go to the vaccination status of Makati City. So currently, Mayor, how many percent of your target population are already vaccinated against COVID-19?
For our residents, I just checked last night. Let's see if there's already an update. We actually have this in our portal. So you can check on a daily basis how many have already been vaccinated. Our target for 70% is at 430. Let's see. Okay, it's uploading. 437,192 to reach 70%. We have already vaccinated for first dose 311,000. 311,000 for first dose, and we have vaccinated for second dose 201.
So those are
201,000.
residents po only, or are there workers in Makati City?
Well, kasi 'di ba kasama na yung A4, dun sa binabakunahan natin. So this is already a mix between residents of Makati or working in Makati.
So, how many percentage po yun, Mayor, yung for the first dose and second dose?
Wait ha, kailangan natin kailangan natin ng calculator para dyan sa sa ilang percent. We'll have to use a calculator for that. But wala pa kami, hindi pa namin na-hit yung aming 437. So, but based on our calculation, we should be able to reach our 70% on the first dose by the end of the month. Hopefully, ma-reach namin yan before the end of September.
Does the city still face challenges when it comes to vaccination?
The challenges is still supply. I'm very proud to say that our daily target is at 4,900, but August 31, we were able to vaccinate over 11,000. Natuwa, kailangan ko lang ipagyabang kasi kami ata yung pinakamadami na bakunahan nung araw na yon ng August 31 because we really wanted we were really pushing for more to be vaccinated. So medyo hindi nasasana yung mga Makati-Sens ko na parang punong-puno yung mga vaccination site. Pero may sistema pa rin naman. Pero the fact that we were able to reach 11,000, nag-overtime pa kami. We were still vaccinating people after 8 p.m. Kasi gusto namin ipakita sa NVOC, sa DOH na kaya namin i-hit yung more than double our target. So yesterday we were able to hit 8,500. That was September 1. Then August 31, 11,174. Tapos even on a holiday, August 13, nagbakuna pa din kami. So ang na-hit namin noong August 30 is at 9,075.
Okay po, Mayor.
So sa amin, supply. Supply ang, kumbaga we've been able to make do with the manpower that we have. So, yung supply lang ng bakuna, kaya nga kami nakikiusap na sana tuloy-tuloy yung supply ng bakuna because it seems that for the city of Makati, we already have the momentum to vaccinate people, and basta kailangan tuloy-tuloy lang yung dating ng bakuna.
So let's say we have a steady supply of vaccines po. Meron po ba tayong target when will Makati achieve herd immunity?
Well, as I said, the target for herd immunity, 70%, as far as first dose is concerned, is by the end of the month. Unfortunately, you also have to take into consideration that the AstraZeneca, the second dose for the AstraZeneca is 8 to 12 weeks. So hindi naman yung nabakunahan ko ngayong September, hindi naman siya makakakuha ng second dose by the end of the month. So we will only reach the 70% herd immunity, especially with the AstraZeneca vaccines. For the second dose is at least 12 weeks. 12 weeks at the latest.
Okay, so on another topic, Mayor, may we know your 2022 political agenda? Do you seek re-election?
Di ba obvious yun? 2022, I am running for re-election because you have to remember, I still have my subway to finish. As I said, our target is at 2025 for the subway. I also have to finish and see the completion of our second hospital ng Makati. So I'm not going anywhere.
So aside from the subway and the hospital, do you have any other projects that you would do should you win the re-election?
Well, marami in the pipeline. I don't want to announce kasi masyado siyang maganda. Okay. No, it's hindi ko kasi ugali na kung 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 rendering pa lang, drawing pa lang, hindi ko siya ina-announce. I announce it when it's already may pondo na, na-budgetan na, mag-uumpisa na siya. So, there are a lot of, I guess that will also be part of my campaign promise in a way. We are still, I have one more legacy project that I hope to be able to start on my third term. Abangan na lang nila kung ano 'yun.
Okay pa. So earlier, Mayor, Senate President Vicente Soto III said that former Vice President Jejomar Binay will run as senator under their tandem. May we know what the former Vice President's preparations for this are?
Well, first of all, I in deference to Senate President Tito Soto, I think my father has yet to announce uh, formally and officially his intentions, whether he is running or not running, and under what party he is going to be running under. So, ibigay natin sa kanya yon, ibigay natin sa tatay ko yung oportunidad na yon para magsabi. So, di pa naman siya nagsasabi eh. So, antayin na lang natin yung kanyang official announcement.
Okay, lastly, Mayor, do you have any final words for your constituents?
I guess sa lahat ng Makatizens, you know it's difficult to have Makati sense na ang taas ng level ng expectation. Um, expect a very wonderful Christmas this year. Hindi lang dahil marami ng bakunado by December, but antabayanan po natin ang ating pamaskong handog na binibigay taon-taon. Medyo may konting surprise sa pamaskong handog na binibigay namin sa aming mga Makatizens yearly. So, ito naman ay para naman maging masaya yung Pasko natin. And rest assured, as far as the city of Makati is concerned, wala po tayong utang. Kahit po hirap tayo dahil sa pandemya, dahil marami pong gastos para matugunan ang mga pangangailangan dahil sa pandemyang ito, ang lungsod ng Makati ay maswerte na fiscally we are able to still provide and fund for our social projects. Hindi ho natigil yung mga programa natin, yung ating libreng cake, libre nating ospital, libre nating gamot. Lahat po yan ay tuloy-tuloy kahit na panahon ng pandemya, kahit na limitado po ang ating pera. Pero maswerte po tayo dahil meron po tayong pondo pa para tagunan ito na hindi ko kinakailangan na umutang. Kung dadating po yung panahon na uutang po tayo, huwag mo kayong mag-alala, sasabihin ko po sa inyo yon. Pero sa ngayon, hindi po napakaswerte po natin, isa po tayong lungsod sa buong Pilipinas na hindi pa umuutang. Dahil kaya pa po ng ating pondo para matugunan yung ating mga pangangailangan. Thank you.
And that is Mayor Abby Binay of Makati City. Thank you again, Mayor, for this interview.
Thank you.
Again, I'm Denisa Fernandez, and this is INQside Look.